There's a number of labs, private and public university labs, have made significant progress in treating diabetes with stem cells. This is new, fairly new breakthrough research, and a lot of them have positive results and very few negative results. What they do is different variations of basically growing stem cells and inserting these stem cells into the diabetes patient so that they can produce insulin. As we know, there's type 1 and type 2 diabetes, and a lot of us in the general public are dealing with type 2 diabetes, and there are those who have type 1 that are born with it. And this really affects each patient differently. And that's what was also observed when using the cell study, or the stem cell study on the patients. So basically, these are genetically engineered cell replacement therapies. It's usually focused on type 1 diabetes, but it can help type 2 diabetes. There is an issue with type 1 diabetes, that these cells could be attacked by the immune system. So they have to figure out ways to get around the patient's immune system and figure out several methods. So this treatment can be custom, especially for type 1 diabetes. With one company, there's a company called, CRISPR Therapeutics. And they basically have the patients inject a small medical implant, and it contains millions and millions of pancreatic cells derived from a company named gene edited stem cell. So the genetics in the stem cells have been edited, and this edit is for the patient, and they basically insert these and they find their way to the pancreas, it looks like. And by taking this one implant, it basically helps them eliminate the need for their daily insulin injections, thereby overcoming any drawbacks of their previous therapies. And it kind of gets rid of the inconvenience of always having to inject themselves with insulin every so often. I don't know how their schedule works, but a lot of us have seen people have to inject insulin, or go to their some of them go to dialysis, but I guess that's pretty far gone, I suppose. I'm not familiar with diabetic patients. I mean, we've seen them, but I haven't followed one to dialysis. I've just heard of it. Another method, they said, as far as this company is concerned, to get around the immune system attacking the cells, they've used immunosuppressive drugs, which I don't know. To me, I'm not a doctor, just a science guy, but that just sounds like it's gonna come with side effects. You watch a commercial and it lists all the side effects, and sometimes the side effects seem worse than the actual medication. So it's like you increase your risk in one area trying to reduce a disease. So sometimes I don't know if that immunosuppressive drugs is worth it. I know there was another lab or another organization where they discussed kind of enveloping the cells in something so that they can hide from the immune system. I think that's a good concept. I think there's a video I'll go over that they bring that up. But the private company I mentioned earlier, again, CRISPR, they used a gene editing technology. I didn't know anything about gene editing technology, specifically anyway. I know about gene editing. We've all seen that in the news and somewhere along YouTube. But I didn't know there's a technology specifically for gene editing. That's news to me. And they basically harnessed that to kind of modify or correct the DNA in those stem cells. And they engineers these cells to evade detection by the immune system. I think another lab tried that as well, which is a good concept if you can engineer the cells without having the patient take drugs. There was another Brazilian study where they had several patients, I think a couple hundred, if I'm correct. I don't know. This was basically a clinical trial conducted in Brazil. 21 adult patients with type 1 diabetes, and they had stem cell infusion, and they had at least for a number of years. This was 2017. This is basically the clinical trial around maybe 5 years ago. and they said that the transplants can succeed in treating diabetes for some, but there's a few patients where it didn't work as well. But I'm sure by now they probably corrected some issues, because it looks like they were trying to study how to customize these stem cells for the patient. And again, you have to worry about the immune system rejecting them and whether it's going to be favorable, and understanding why it fails for some patients. I think that's important. There's probably, of course, there's always going to be other factors involved, because biology is not like technology, right? There's so much unpredictable and things are more difficult to control. It's like technology, you can just hit the reset button or, overwrite your config file. Again, I've mentioned that before in other videos. But in this case, with the stem cell treatment, some patients have lasted a couple of years without having to take insulin. But there's some point in time, they say after those few years, the benefits decreased and they eventually had to resume insulin. This is a Brazilian study, again, that was around 5 years ago. So I'm assuming that maybe there have been some improvements. They also said that the stem cells were, I don't know what this means, autologous? I don't even know what that means. Anyway, I'm not even gonna pretend to know what that means. Oh, so that means, it says what it means. It means it came from the umbilical cord. Basically, they also said that the umbilical cord blood is the best source for stem cells. And that's the thing. Like, you don't know this when you're born. A lot of things we don't know when we're born. So your parents don't think, especially you as a newborn, is not going to think, because you're not going to know anything. You just want somewhere to eat and someone to lay on. But I think maybe it should be a standard, like save the umbilical cord for stem cells for each individual, right? Because if it's a standard practice, like maybe it was put in your own property, of course, you and your mother, if this was somehow be made some type of standard practice where your cord was stored somewhere for years in case, it's needed for something, and they could grow your own personal stem cells for this reason. If you never need it, then maybe you could donate it for something, even though it's more difficult because, again, that means your stem cells become a foreign body for someone else if they are used. And then here comes the immune system with the intention to rescue, and then doing more damage than you would like, or that person would like. Again, there are so many methods that researchers from different organizations, universities, or even private labs are looking at as far as getting past the immune system, whether it's using gene editing to avoid the immune system, encapsulating them, or the old-fashioned immunosuppression drugs, which is to me is not the best scenario. I probably wouldn't even go that route. To me, it's my personal issue. It's like, I think you're better off just taking insulin if that's the case, but it still looks promising outside of that. I'm going to take a look at a few videos that go more into detail about how the stem cells help you get rid of diabetes, or cure, quote unquote, cure diabetes. And the first one, it's pretty extensive, illustrative. I'm not gonna watch the whole thing, but we'll take a look and check in more detail.
Beta cells respond to blood sugar levels similar to a thermostat. When the temperature gets uncomfortably high, the air conditioner turns on to bring the room back to a normal temperature. When blood sugar levels get too high, beta cells turn on and produce insulin, which will reduce blood sugar levels. In type 1 diabetes, beta cells are destroyed by the body's immune system. In type 2 diabetes, beta cells become dysfunctional and cannot produce enough insulin. In both cases, the loss of functional beta cells lead to elevations in blood sugar levels that damages organs and, if untreated, can lead to death. At present, diabetics inject insulin with a syringe or pump, but providing insulin by that means is nowhere near as exact and effective as having functional beta cells. To treat diabetes, scientists are trying to replace the missing or dysfunctional beta cells. To do this, they have turned back the clock to the time when we were all single cells to understand how beta cells are naturally produced. The development of beta cells in the embryo involves the coordinated activation of a very specific set of genes in a very specific sequence. Scientists have been able to map out these genes and have been using this information to create their own beta cells from stem cells. By replicating exactly what happens in normal development of the embryo, scientists are creating beta cells in a petri dish. And these new beta cells are functional. They can produce insulin in response to blood sugar levels. Scientists are now solving a new challenge. How do we introduce these cells into the body and keep them alive? One challenge is to protect them from the immune system, which is responsible for killing beta cells in type 1 diabetes. One possible solution is to use encapsulation, or modify the surface of the cells to make them invisible to the immune system. Scientists also want to make sure they can produce enough viable beta cells to make sufficient insulin when the body needs it.
You can see there at the end they even discussed the different various methods, well, 2 methods of how they can get the beta cells past the immune system. Whether they're going to attempt to encapsulate them or edit the gene and somehow change the surface of the beta cells. Both ways to make the cells unseen by the immune system or invisible to the immune system. The next video I'm going to take a look at looks into stem cell therapies and regenerative therapies to address the diabetes issue. They seem to focus more on type 1. I think they cover type 2. Let's take a look.
For diabetes, stem cell therapies and regenerative therapies.
Type 1 diabetes results from the destruction of pancreatic beta cells, which means we need to replace them. In people with type 2 diabetes, the beta cells are destroyed due to the constantly elevated blood sugar levels and the many lipids and fats in the metabolism. The cells lose their function. But in this case, we can use medication in an effort to protect the beta cells against stress, or even try to regenerate the patient's beta cell function.
The biologist is conducting research into potential ways to treat both types of diabetes at the Helmholtz-Zentrum München. Lickert hopes to use stem cells to produce beta cells in a laboratory, which could then be transplanted into a patient. To create new beta cells that could produce insulin in a diabetic patient's body, researchers need to differentiate pluripotent stem cells. After several steps in the cultivation process, these stem cells become beta cells. However, in the case of type 1 diabetes patients, the body's own immune system poses a problem because it would attack the transplanted cells as foreign bodies. So, how could these cells be protected?
Yes, in beta cell replacement therapy, stem cells solve the problem of finding an organ donor. What we haven't solved, of course, is the issue of organ rejection, which occurs with all organ transplants. This is when foreign beta cells are transplanted into a patient and their body identifies them as foreign matter. This means we need to protect the cells to be transplanted. There are various approaches. One option would be to encapsulate the cells, so that the immune system doesn't see them and attack them. Another approach would be genetic manipulation of the stem cells, which would effectively make them invisible to the immune system.
When it comes to therapies for diabetes, the stem cell researcher and his team have no shortage of ideas. In fact, Lickert hopes to use an entirely new regenerative approach to restore healthy function in the diseased pancreatic cells of type 2 diabetics.
To do that, we need to understand the molecular principles at work. We need to find molecular footholds and develop medications that can trigger these regenerative mechanisms in diabetes patients' bodies.
Lickert's team has discovered a previously unknown receptor on beta cells, which opens up the possibility of new ways to treat diabetes with medication. The insulin inhibitory receptor, Inceptor. Blocking Inceptor's functions significantly increases the sensitivity of the insulin signaling pathway in pancreatic beta cells. This could regenerate beta cells' functions and thereby help the body to halt the diabetes itself. Heiko.
That's not a bad idea as far as regenerative options. Basically, regenerating your beta cells, which helps you to basically to avoid using foreign bodies. That's a pretty good option there. They also listed helping to increase the sensitivity of the insulin receptors. I like those. Those seem more less invasive methods. The stem cells seems good as well, but I like the alternatives they provided to help assist with this diabetes, basically regenerating the patient's beta cells, along with increasing the sensitivity with the insulin receptors. I think those are also, again, great ideas. Let me know what you think. I wish I would have more time to look into those as well, but I was just focusing on the stem cells, the beta cell treatment. Again, thank you so much for taking time out to listen, and let me know what you think, and please like and subscribe. Please, please, please. Thank you so much.